Israel has become the first country to begin providing citizens with a third dose of a COVID-19 vaccine. The booster shot is now available to people over the age of 60. The campaign was kicked off by former Prime Minister Benjamin Netanyahu receiving a third dose of the Pfizer BioNTech vaccine. Meanwhile, hundreds took to the streets in Tel Aviv to protest against the government's new COVID measures and its calls for all citizens to be vaccinated. While more than 55% of the Israeli population has already received 2 jabs, only 11% of Palestinians living in the Palestinian territories have been vaccinated so far. For more on this, let's bring in Professor Eyal Leshem, Director of the Center for Travel Medicine and Tropical Diseases at the Sheba Medical Center. Professor Leshem, it's good to have you on the program. Why is this third shot necessary?
Well, Israel has observed a decline in vaccine effectiveness in a subpopulation of citizens aged over 60-year-old, so older citizens who were vaccinated back in January. Now, this decline was not attributed to the Delta variant because older citizens vaccinated later in April and May had a very good vaccine effectiveness. And so there is a hypothesis this is related to decline in antibodies levels. And therefore, the government has recommended a third dose, a booster dose, to increase the level of antibodies in this subpopulation at risk of severe disease.
Why is Israel opting for a third dose when this has not yet been internationally recommended?
Well, sometimes in public health, like in other fields of medicine, you have to take a decision in a situation of uncertainty. Now, we have solid data to show that the level of antibodies is declining, and we see that there is increase in the number of infections in fully vaccinated. And then you can do one of two choices. You could wait and see if indeed older people will get severe disease despite 2 doses of the vaccine, and you can go ahead and with lack of data but with reasonable medical decision, provide them with a booster dose to increase the protection.
Now, there's been quite some resistance among Israelis towards vaccination. And news of the third jab, wouldn't that make them even more skeptical?
Generally speaking, the Israeli public has received the vaccines very well, and this is shown through the very high coverage rates. So, for example, in Israeli citizens above 50-year-old, more than 88% received 2 doses of the vaccine, which is exceptional. It's not seen in many other countries. There are always pockets of hesitance or of resistance, and we try and communicate and provide the information from credible medical sources, but we don't think the third dose is a major source of resistance.
And very quickly, do you think it will be necessary for us to have these annual, jabs, third jabs, and moving on, having annual shots to keep up, just like the flu shot?
It is actually very difficult to predict what will be the unfolding of this disease or pandemic, because on one hand, we actually do still see very good vaccine effectiveness against severe disease and hospitalization, but we are seeing breakthrough infections. So what we think is that the disease will continue to circulate in coming years, and we will simply become another viral cause of pneumonia. And so the way to prevent severe disease will be through vaccination, perhaps in the influenza model, where every year you get an updated booster. But all this is still to be unraveled as we move forward with the COVID pandemic.
Okay, thank you, Professor Eyal Leshem, Director of the Center for Travel Medicine and Tropical Diseases at the Sheba Medical Center.
You're welcome.